Second year medical student at McGill, and I'm going to present to you a research project that was done in the summer of 2019 that was working with indigenous community health workers to understand the obstacles in implementing micronutrient programs in Ecuador. We did this research with community health workers of 3 indigenous communities, so Chilcampamba, Morales, Chupa, and Arayanes. So as you may know, micronutrient deficiencies represent an important global burden, and in indigenous communities in Ecuador, where there is poor nutrient-rich diets, this is a very important problem. So we try to understand the current public health micronutrient program of supplementation of micronutrients and evaluate the challenges related to the adherence in indigenous communities. We then wanted to come up with a list of recommendations to improve the program and disseminate the information with the local health officials. So we did that by doing 7 focus groups with caregivers of children less than 5 years old, as well as 23 semi-structured interviews. We then developed a list of recommendations and then established a list of concrete improvements for the micronutrient programs by involving the regional health direction in Cotacachi. So here are the results. So caregivers have several perceived issues. The indication from the doctors and their nurses being often not clear, sometimes false. There's also inadequate follow-ups and misunderstanding around the appointment call center. There's also a relation of mistrust between the mother and healthcare professionals due to bad experience or bad treatment in the past, as well as deficient attitude and behavior of the healthcare professional. There's lack of knowledge regarding what are micronutrients and what is micronutrient supplements. There's also attention to home visits being there's also a preference for explanations in Quechua, which is the dialect of indigenous communities. There's also perceived factors hindering the proper adherence by healthcare professionals, most important ones being not attending to the controls being appointments to make sure that the children are going in a timely manner, inadequate alimentation, indigenous belief, the side effects of the supplementation, and lack of knowledge. So while all of these factors can be worked on in order to improve the current state of micronutrient deficiencies, there are important social determinants of health, such as food insecurity in indigenous communities, and that are very bigger problem and need to be worked on by higher level stakeholders. So there are several engagements from the regional health authority. So they wanted to educate frontline health workers to improve information around supplementation. There's also encouraging a change in attitude of behavior of healthcare professionals, educate the population on using the appointment call center properly, introducing more people who speak Quechua in the primary healthcare setting, and improve follow-ups and indicative workshops in the communities. And we did all that using participatory research to have indigenous people as active participants in the research. Thank you.